Next up on our tour of these damp little islands, we go to Wales and Rob Orford, who's Chief Scientific Advisor for Health to the Welsh Government. Rob.
Good morning. Thank you so much for the invitation. My internet just absolutely dropped out on me, so that was rather thrilling. So I will try and work through my slides as best possible to cover as much ground, but hopefully I'll give you some names and references that you can look up on your phone whilst you're dialed in. So I'm the Chief Scientific Advisor for Health in Welsh Government. I've been there for 5 years, and I'm also the Professional Lead for Healthcare Sciences in Welsh Government. I'm very grateful for my colleagues who have been helping me, Chris Newbrook and Michaela John. Most of my focus at the moment is towards that awful COVID-19. It has been for the last 2 years. So it's a real privilege and an absolute pleasure to be talking about genomics for a change. What I'm going to do is give you a whistle stop through some of the really excellent work that's happening in Wales. And give some background of what we're planning to do in the future. So growing up in Wales and born and bred, we've seen the demise of our heavy industry, a really big cultural change, and the gradual loss of our churches and chapels and community centres where communities and people would come together for intellectual debate and culture. And that was lost, unfortunately, over years, but new things are growing in their place. I think in Wales, as well as rugby, community is in our cultural DNA, and I hope today to show you that where we've lost, we've gained in other areas, and we're growing our community for genomics here, and it's thriving. So, whilst we're a small nation of only 3.2 million people, there's enough to do interesting things. There's few of us to do them, so we need to look after them, but we really have some bright shining lights and assets in Wales that are doing quite remarkable things. Without further ado, I'll move on through my slides. So a little bit about the background of where we are, where we've been recently, and where we're going in the future. Back in 2017, when I joined Welsh Government, our then Minister Vaughan Gethin sponsored a Genomics for Precision Medicine strategy to improve genomics in Wales and to support people and patients and improve outcomes. We had other programs come online at the same time: imaging, pathology, advanced therapeutic medicinal products, and whilst they're separate, they're all connected into one virtual circle. And arguably our healthcare science program is connected in, and the other wider programs like digital and other priorities of Welsh Government are connected into this, connected in this space. So here we see the headstock or the winding gear of Genomics Partnership Wales, our community that we come together and we forge forward in genomics. Importantly, at the top, we've got patients and public, and I'll start by talking about the patients and public. It's probably the most important part of our genomics strategy in taking that forward. So the vision for genomics in Wales was to work together to harness the potential of genomics for the well-being and betterment of people in Wales, as well as prosperity. And very briefly at the bottom, you can see the different areas that we focused on. So it's for people, it's about people, and it's to help us understand ourselves and improve our health. So co-production, as Ian Young was telling us, is a very important area. If you're a member of the public, if you're interested, if you're a patient, then you're more than welcome to join us on our journey to join our community. And our PPI community has been running since 2019. We have involvement at every single level of the program, with 2 members on the program board and the governance board, and underneath the public sounding board. So it's all about doing with, not doing to. That's really important, and it goes right down to our grassroots with genomic cafes and lots of outreach events, with our PPI board really getting involved at every single level. Now we're mainstreaming that, so it's part of the machinery of everything that we do. And it's fascinating to sit on the program board and the governance board and to listen to our public members and their opinion and their reflections, which are often quite different from the professionals and policymakers. And it's important to have that connected voice as a key part of the work that we're doing. So some of the recent successes I'll go through now. So since 2017, we've been pushing forward on a number of areas. One area of success is the Wales and Infant and Children's Genome Service through the All Wales Medical Genomics Service. If you look at the website on the bottom, there's some excellent web pages, both for the members of the public and professionals. So I would encourage you to look at that. And again, these are led by incredibly bright, very talented people. Sian Morgan leading the genomics service, and Sian Corrin leading this piece of work. And there's some really nice there's a really nice article on the BBC actually of the 3rd of August 2020. So this program has been running since April 2020. It was the first UK diagnostic rapid whole genome sequencing program. And we're utilising our Novasec 6000 in Wales. The second one is on its way to support that journey and enable us to do more whole genome sequencing. So whilst we're a small country, so to date we've pushed forward 38 different children have gone through this service, with 15 of them giving us a diagnostic yield of about 40%. So this is having a considerable impact on that diagnostic odyssey that children unfortunately go through when they're severely unwell. So moving forward, another area that we've pursued is pharmacogenomics, and we've had some real assets in Wales. Professor Dyfrig Hughes from Bangor University, who's a professor in pharmacoeconomics, and Richard Adams, who's a professor oncologist in Velindre and with Cardiff University, really come together and led the development of the service, looking at the use of, I always struggle with fluoropyrimidine-based chemotherapy. So people who are sensitive to certain chemotherapy, and about 7% of the population have mutations in the DPYD gene that make them sensitive to the certain chemotherapy. And so in this service, over 3,000 patients have gone through. That's about 60 a week, with a diagnostic yield of 6.91%, with a turnaround time as little as 3 days to identify people that may be sensitive and have adverse reactions to that chemotherapy. And so there's some really, really good examples of how this has worked well and how this has benefited patients and created value in the system and averted adverse drug reactions. So the next slide is Cysgodi. So this is a genomics cancer panel service that's been developed. Rhian White in the All Wales Medical Genomics Service leading work here. Cysgodi in Welsh means shelter, and it's a service that looks at solid tumours and hematological cancers. And it's a real step change actually. So this is a group that's been running. It's building on firm foundations from about 2009, and the step change in the service is going from 30 genes to over 500. So that's really quite significant. So we're able to look at point mutations, copy number variants, translocations across over 500 genes and over 50 RNA genes as well. So lots of people have come together to do this, lots of consultation, lots of multidisciplinary working in that community. So a lot of this is coming together. And if you look on the BBC Wales, on the 23rd of September 21, there's a really, really good story, really contextualizes this for a lady called Kate Moulton, a cancer patient in Cardiff who had stage 4 cancer. So it really did change her experience. So I would encourage you to look at the resources from the All Wales Medical Genomics Service and also those stories on the BBC. So then in our community that cuts not just into human genomics but also pathogen genomics, we have the Pengu unit, the lovely little penguin on the left-hand side, and again led by some insanely bright people that are so hardworking. You've got Professor Tom Connor and Sally Corden that are really pushing this service into incredible places. I think throughout the pandemic, Wales have consistently been about in top 10 in the world of sequences that they've uploaded. So being such a small country, that's no mean feat. But it's because we've built upon a firm foundation, things that we had in place that we're building upon. And again, those assets that we have leading those organizations has been incredibly important. So you can see here the scale of the operation, over 150,000 samples sequenced and over 100,000 uploaded to GISAID, with significant contributions to understanding by working collaboratively through COG UK and the amazing work that Sharon Peacock and colleagues have led there to really highlight the benefits of this precision public health approach. So Tom and colleagues have contributed to over 100 SARS-CoV-2 outbreaks and analysed them, and the work they've done on phylogenomics and other bits have really helped us understand, and at policy level enabled us to respond more effectively to COVID-19 in Wales. So again, as I mentioned previously, this is built on a firm foundation. It's a UCAS accredited services in Penga with ISO 15189. There are other services being run through Penga microbacterial service, looking at resistance, speciation, and surveillance for tuberculosis and non-tuberculosis, C. difficile for typing and outbreak response, HIV looking at resistance, and I think per capita for influenza, Wales had the most genomes per capita sequenced out of the UK. So doing absolutely amazing things, and I'm sure Tom and Sally can be incredibly proud of the effort and contribution that they've made to the COVID response. Okay, Wales Gene Park, another important component of Genomics Partnership Wales, led by the director Andrew Fry and Karen Reid, had a really important role in education, engagement, and involvement. So this is an infrastructure support group that's funded by Healthcare Research Wales, a part of Welsh Government, to take forward education and involvement. And there's been a huge amount of work that's been going there over the last 20 years, with over 120 events a year, engaging more than 6,000 people. And there was a really, really large showcase in 2021 that was organised with over 52 talks, over 6 stages, and 1,200 people engaged. So really helping us mainstream and get genomics into the fabric of our society and our culture, and thinking about what it can do for us as people and patients. They work closely with the Genetic Alliance and rare diseases, and it's a really important work that goes on there through engagement, but not just engagement. They also work on encouraging and supporting genomic research in Wales, with over 30 research projects working alongside the infrastructure support team there, and a large amount of bioinformatics and a bioinformatics team that's there. So they work closely as well with the All Wales Medical Genomics Service, and linking in with other assets that we have in Wales, the Secure Anonymised Information Linkage Data Bank in Swansea. It's part of the HDR UK infrastructure, and I think you'll probably hear later from Andrew Morris on that, but that's been an incredible asset for us in COVID to have that linked data set in Wales, and again building on those investments that have been there for a significant number of years. Workforce always appears to be 70% of the challenge for us, 70% of the cost significantly. So how do we mainstream? I'm sure we've heard this in other talks. How do we mainstream genomics? How do we support the current staff there to be upskilled to understand how they can access and use genomics? Has been a key part of the work that we've been doing. So we've launched the Genomics Champions Initiative. We've established the MSc in Genomics Medicine, and there's been significant recruitment of genomics staff since the beginning of the program all those years ago that pre-COVID seemed so far away. So some significant work going on there on workforce. I won't dwell on the challenges. I think they're probably well versed and familiar with everybody, but we're heading into those challenges, and now trying to sharpen our appetite, sharpen what we're doing, and go after them in the next phase of the work that we're planning. So in the future, we'll go back to the engine room. We're building this co-located site on the edge of Cardiff. We're bringing together partners, the Pathogen Genomics Unit, the Wales Gene Park, and the Wales Medical Genomics Service. into an improved set of facilities. So really coming together to build that collaborative approach and bring together economies of scale with sharing of infrastructure. I mentioned that the second Novus X6000 coming in, but sharing those digital resources and providing the right care to the right patient at the right time. So co-designing and co-producing what we're doing such that the experience of people using clinical services is appropriate and timely. So it's incredibly exciting. The building work is underway, and we hope to be occupying that site in about 2023. We're also working collectively in a connected way with the southwest and the north of Wales to create additional regional nodes there. So building outwards as we go. So there's a lot being done and lots of exciting activity. We have to drive more with the PPI. We have to build that alumni. We have to broaden the sounding board to get more voices there, and then transition this into an integral part of service delivery. So that's something that we're really keen to expand outwards and see that as an absolute requirement, an in-house activity. And what we're learning here, we're applying elsewhere to our other precision medicine programs. I'm very conscious of the time, and I've got quite a lot of detail that we could talk about the future ambitions about rare diseases and intellectual disability service, the expansion of whole exome and whole genome sequencing into routine workflows, cancer, the use of liquid biopsy, using cancer profiling at the beginning of the diagnostic journey, establishing a national pharmacogenomic service, and investing in decision support services to enable the use of effective genomic services for pharmacogenomics, and then expansion of sequencing into the newborn screening services, and then bringing that back into the treatment. So understanding in that precision medicine of the diagnostic side and the treatment side. So joining that loop together. Probably no surprise, the future ambitions of pathogens are vast. We've seen the utility, we've demonstrated the benefits of this precision public health approach, and so we need to build on that and further understand how we can use pathogen genomics to prevent infections, healthcare acquired infections, to look in more high definitions at those, and then expand upon the good work that's going on. There's a very good program of work on wastewater for COVID, and there's plenty of opportunity to extend on that into other environmental threats, but also think about this as a One Health approach where we're connecting human health, animal health, pathogens, and the environment, and it's sustainable for us in the future. So lots of ambitions around expansion. Now the tip of the iceberg is the sequencing and all the good stuff underneath for the bioinformaticians. So we need more bioinformaticians. We need to create really nice journeys for them where they can transition from academic institutes into NHS services. So things like the equivalence pathways and the work that we're doing through the healthcare science framework will be really important to keep bringing people on board and enabling people to work and have careers straddling academia, straddling clinical services and industry with industry fellowships. So we're really keen for Wales to become a destination for genomics, to bring together our assets and other people to join us. And we know that the triumvirate is academia, service and industry. So we need to be together at the beginning to take this One Health approach and be evidence-led and value-led. So we understand that we're improving outcomes, we're improving experiences, and we're understanding the costs of what we're doing as we move forward. So we're working closely with the other nations, with Genome UK. We have a new minister in Wales and a new health minister in Wales, Eleanor Morgan, and a new programme of work for government. So this is really exciting. There's lots of stuff going on. We're working closely with the EU community so we can, all of us together, help better understand our health, to drive research and innovation forward, to create new knowledge and apply that new knowledge into clinical pathways, and to work in industrial partnerships to develop new innovations and put more bums on seats in Wales. So I'll go back to our winding gear. At the top of our mind here, it's so important that we work together. There is so much more we can do when we work together in trusted environments and in these federations between connected organizations to create our community. So there are so many people I could thank. I haven't got time to do that, but you can always contact us, and we're very happy to put you in contact with people. So please tweet us, please email, and please get in contact, and please join our community. I'll stop there. Thank you.
Thanks so much, Rob, for that whistle-stop tour of what's going on in Wales. And it's a lot. There's a huge amount that you're doing. And actually, one of the things that I took from both your presentation and indeed from Ian's before is this thing about it, the importance of mainstreaming genomics with your population. Mainstreaming for all sorts of reasons, for trust, for to to get people to realize that actually genomics is particularly in bioinformatics, is a really good career choice. There are all sorts of reasons to mainstream genomics. And are you linking up? Is it just isolated things that you're doing? Because I feel that as a whole country, we need to get genomics mainstreamed, and not just amongst patients.
Yeah, absolutely. I agree with you. And I think one of the benefits of COVID is that there's far more science literacy across the UK and globally. I think people talk knowledgeably about diagnostic tests, exponential curves, RT ratios, and sequencing. And I hope that when the tide goes down, we're left with the good bits, that the appreciation of the pursuit of new knowledge, the use of evidence to inform decision making, and greater scientific literacy, including genomics, so people understand where the potential is. And I think it's up to us as scientists to take forward that science communication and build on what people want and what people know. I think probably 2 years ago, people probably wouldn't have known the name of the deputy CMO in England. Now he's a national figure, which I think is incredible. So, there are some real benefits that we need to cling on to, such that when the tide goes down, when we don't lose them. And I think genomics needs to be one of those shining lights that we keep pushing forward and cling on to. Thank you.
And partly, although we all, of course, want to present genomics as this extraordinary, amazing, super thing that's so exciting, actually, for the public, it's just medicine. It's just another way of doing medicine. And actually, there is a value in treating it like that, so that you don't startle the horses and, get people really worrying about some aspects of genomics.
Yeah, well, there was an excellent document, a foresight report published in the week that I'm sure you've talked about, called Genomics Beyond Health. And I think that's a really good narration of the potential utility of genomics and how ingrained it is in so many different parts of our lives and so many different sectors. So I think we need to be bold, and actually the work with our PPI groups, that that those groups are more bold than we are as policymakers. So we need to embrace that and be open and transparent and share and publish as much as we can, as quickly as we can. So yeah, I think we just need to keep pushing forward.
Thank you so much, Rob Orford, Chief Scientific Advisor for Health for the Welsh Government.